Hello and welcome to the Lou Review. I'm your host, Rosa Hart, and today I'd like to share with you an organization that I just found out about recently, and it's making a huge impact on the lives of people who really need it. And my guest today is Janet Warren, the Executive Director of Hope Health Clinic, Kentucky. So welcome, Janet.
Thank you. Glad to be here.
Yeah, it's an honor to have you.
Thank you. Hope Health Clinic is a charitable healthcare clinic. We see people who don't have insurance, or if they have insurance and can't afford deductibles, they don't have access to health care. We're there to take care of them. We're located in Grange. We've been in business about 12 years. Not only do we do primary care, we also have full component of laboratory care, and we have an in-house pharmacy for our patients to be able to get their medications.
So people can come there and see like a nurse practitioner, or do you have physicians there
We do
too?
have two physicians that are there on a monthly basis.
Okay, and so they can come have their appointment and get their prescriptions filled all in one spot?
All in one spot. Now, they generally can't pick their prescription up that same day, but I am adding more pharmacists so that we can have daily prescription needs met, and then patients have them as they walk out of the clinic.
Great. And then is there anything else that you do there on site? I mean, that's enough, but...
Well, we do a lot of patient management, and we have patients who need referrals to specialty care. Of course, when they don't have insurance, then we have to navigate those channels of how to get them financial assistance through whatever system we're working with. We do a lot of specialty work with pharmaceutical assistance programs for the meds that we can't carry in-house. For instance, there's an insulin called Trulicity. A month's supply is $1,600. There's no way we could do that. So we're able to get it for free through our pharmacy, and that is something that we're able to give to our patients at no cost, and other medicines too.
Is there a cost for them to come and see the providers and have that primary care visit?
Yes, the cost to see a provider is $15, and we accept cash, credit, or debit cards. Our labs, a full component of basic labs, is $38, and that's like 5 or 6 labs. And then again, as I said, the medications that we dispense are available at no cost to our patients as well.
Wow. Now, how are you able to do that?
Well, we have 24 churches that support us. We do grants, and we have requests to foundations. We have individuals who support us. Our patients, even though it doesn't seem like a lot, our patients generate about $40,000 a year.
Okay.
We're in a facility where we only pay $1 a year rent.
That's a blessing. Wow.
It is, and the utilities are paid for as well. Those two together are worth about $100,000, so that keeps our cash budget down and provides a service to our patients. Our current space is about 3,600 square feet, so we're able to have 6 exam rooms, a large pharmacy, meeting room for patient education. We're completely electronic records, just like any other normal practice is. We do have a lot of volunteers who help too. That's another way that we're able to deliver the services we do at such a reasonable price.
So what kind of things can volunteers do at the Hope Health Clinic?
Well, obviously the first place is our front desk, where they can answer the phones, schedule patients, check them in, check them out. Then there are nurses, volunteer nurses. There are nurse practitioners, pharmacists, pharmacy technicians, and just anything else that might come up along with translators. We have a large Spanish-speaking population, so translators are also a great need as well.
Definitely. And that's actually how I found you. I'm friends with one of the pharmacists who volunteers there. And she was like, Rosa, you have got to meet Janet and find out more about this Hope Health Clinic. So is this something you started, Janet?
Well, in 2010, there was a clinic that was located where we are. Actually, they were in the building we were previously in, which was much smaller. And they were only open 2 days in the afternoon and then one evening in the week. And they just weren't open long enough to garner any supporters or start generating the needs of income and patients that they needed to be sustainable. So they closed in 2010. The community came together and decided we need something there. We know there's a need. Even though Oldham County is the healthiest and wealthiest county, you go out to Grange, that's about a 15% federal poverty level there, which is higher than the national, which most people don't realize that. Then you look at the other counties that are out and around, and the need is there. So this group spent about 3 months in trying to figure out what model we would have. And once that was decided, we partnered with the Foundation for a Healthy Kentucky, and they did a 3-year grant, $100,000 a year, which we matched. And so that was our launching. And then from there, here we are today.
Wow. And have you been with it since the beginning?
I was part of the group that worked on developing the model that we would have. And I actually was recruited to get the volunteers scheduled and get them trained. And then we hired someone to take the lead role, and it didn't work for them. And I got a call where I was working, and they said, "Can you come back and just help the volunteers?" And I'm like, "Sure." Middle of the night, I was awakened with a voice that said, "You need to go apply." And so 12 years later, here I am.
Oh, wow.
Yeah.
So you really just had a definitive, calling
I had a
to
call.
do this.
Exactly.
Wow. Do you have any, let's go into the Janet story now. Is this something that you've done before? Have you led an office before?
No, I worked 26 years at Southeast Christian Church, and I worked for many years in events. And so obviously, most people know that they have been known for doing large events. So that was food service and room setup and scheduling. So I had a large team that I worked with, and I am a driven person. I love to be able to serve people. And so that puts me in a role where I am now that is perfect for my skill sets and my passion of what I do.
Wow. That is really awesome how, that's just been a pattern for your life and working with people and serving. And because I think a lot of people want to serve, but a lot of people who are really good-hearted are also not necessarily prone to organization. Organization is a gift, and it sounds like that's one of your gifts.
It is mine. It is definitely one of mine. Yes. Right.
Well, that's awesome. They're really lucky to have you. So where exactly is it located? Can you describe the location of it right now?
Our address is 1023 Sanibel Way. We're on the in between the campus of the Baptist Hospital in LaGrange and the Walmart, which is located in LaGrange too. We're just sandwiched in between the two there.
Yeah. And so who would you say the majority of your patients are that come into the Hope Health Clinic?
Well, strangely, most people think they don't work. No, they do work. They are the working poor. They're at your grocery store. They're at your gas station. They're in your daycare centers. They're part-time bus drivers. They're part-time employees of school systems. They may be cutting your grass. They may be doing childcare, and they don't have insurance, or they can't afford to buy insurance. We do have a lot of non-English speaking patients, which 97% of our patient base is employed, regardless of what their background is or where they came from. So they just have a right to have health care, and that's one of the strong things that we feel is very positive, that we need to be able to create a warm, welcoming environment where they can come, know that we're happy to see them, know that we're going to get to know them more about, when we take turns delivering medicines to our patients, so we know where they live.
You deliver the medicines to their homes?
Not all of them, but where we can, we do. And so it's kind of grown. When you've gone once or twice, they'll say, "Come in for just a minute and sit down and eat dinner with us." Well, we don't necessarily want to do that, but they want to hug you. They want to tell you how much they appreciate it. They're no different than you and I.
Yeah.
And so it's very rewarding. And a couple of times I've taken my husband with me, and he said, "I see why you do this. I see why you do this."
That personal connection, because you're showing those people that they are valuable and
they're no different than me.
That. Oh, yeah, definitely.
No different than me.
Maybe harder workers and tougher than me if they're out there doing lawn work.
Or whatever they're doing. Yeah.
And it's crazy because we think that, employers are supposed to provide insurance, but is it still just that if you have 50 employees or more, you have to provide insurance or something like that?
I think that is. I'm not very familiar with it.
So like smaller
But even
businesses
larger employers, the deductibles in so many. We saw a gentleman today. He doesn't make that much money, but his deductible is $8,000.
Oh my! For one of those high deductible plans.
Yeah, and that's with an employer. So,
was that a part-time job?
No, it's full-time.
What? That is
wild. If people are blessed enough to work for an organization that provides really good health care, and you may not get it free, and you may not have a large deductible, you're definitely in the minority today.
Wow.
Definitely in the minority.
That is just crazy. And I think we had so much availability of resources during COVID because, they wanted people to be able to get care to prevent the spread, right? And so we had a whole lot of you can access all this health care for no cost to you, or emergency Medicaid and things like that, y'all. That's gone now.
Gone. Yes, exactly.
So, now, can you tell us some more about the organizations you're able to get discounted meds through?
Yes, we work with a place called Dispensary of Hope. They're located in Nashville, Tennessee, and that's our largest supplier of medications. We pay about $7,500 a year for the expense of shipping. Obviously, the cold pack shipping for insulins and so forth is very expensive. We get most of our oral medications from them as well. We also have a partnership with Direct Relief, and so we can get medications from them. We can get other things like right now I've got shelves of vitamins and emergency immune type medications, or we'll get a wide assortment of over-the-counter things that we can give to our patients. That it's just a nice little plus to add to what they can take with them when they leave our clinic. Sometimes we have to buy a few medications if we can't get them at the same time that we need them. So we'll buy a few. We're part of the National Association of Free and Charitable Clinics, and we have partnerships with various organizations. Henry Schein is one. Direct Relief is one that's part of that, and so is Dispensary of Hope. AmeriCares is another one that we have an opportunity to order things from them as well. So we search till we find what we need.
Yeah. And if you turned over almost every stone, you just got to turn over every stone until you get
keep
all
turning
the resources,
over stones.
Right?
You think you've got them all turned over, but then somebody else comes to you with one more thing. And the only thing we can't do is accept medications from individuals, whether they've been used or not.
Right.
We are licensed by the state of Kentucky, so we're required to accept and only receive things from licensed distributors as well.
Well, that's a good safety.
Exactly.
In there. So how do you get the funding for the stuff that you do have to pay for?
Again,
you said the grants,
things,
right? Is there a way people could donate if they
citizens
want to help?
We have a lot of citizens, individuals who donate. We have, as I said, churches donate. Businesses can donate. One of the things that we're looking at to implement in 2024 is an urgent care setting for patients. And working with employers, if their employer comes to work sick, they can send them to us at the end of the day or whatever our hours will be for that, and know that they will be seen. And again, it's only $15. So for those people who can't afford it or don't have insurance, they would have care immediately that course of that day. The goal is to keep them at work. Yeah. If they miss a day of work, that's a big hit on the family's income and resources. And then that in turn puts a burden on other social services throughout the communities as well. Because somebody's got to help them pay rent. Somebody's got to help them with food. Somebody's got to help them with utilities. It's also, we work with the schools. So a lot of times the schools will call us and say, I've got a sick kid. Get them in so we can get them back into school.
Oh, wow. Is that the Oldham County schools?
Right now it is. I mean, I've had some Trimble and Henry County kids as well.
And what exactly would you say is your service area? Because I think you mentioned surrounding counties. Can you name those?
Well, when we first opened, it was Oldham, Henry, Trimble, and Carroll. today we see people from Jefferson County, a large growing contingency of Jefferson County. I've got Shelby County. We have people as far as Gallatin, on up 71. If they need help and need care, even people from southern Indiana, we're never going to turn them away. We're going to take care of them. And if we're not the proper place for them to be,
or you know of another existing resource nearer to where they're from. Exactly. Because maybe they don't know.
Exactly. We will get them connected to where they need to be long term.
Have you seen a lot of that?
Yeah.
Where people just don't know about the resources down the street kind of thing?
Well, there's not a lot of advertising of the charitable clinics. I know
which is fair, because you don't want everybody to come in looking.
You don't have money.
You
don't have money. We don't have an advertising budget. Everything is either through our Facebook page or word of mouth, and our patients are our best promoters of our clinic.
So would you say, like, obviously you're here, right? So one of the questions that I asked you was, is this something you wish more people knew about, or are you unable to meet the demand?
I wish more people knew.
Okay, so you would be able to meet more of a demand if more people knew that you were there to provide this service.
There's 7 days in the week. We could add other days. We've got the space, the capacity. If more people need us, then we will figure out more ways to get additional. Today I had 3 people, nurse practitioners, who want to come in and volunteer at the clinic.
See, and we hear about the nursing shortage and, like, all these people not wanting to work. But, I mean, it's such a great cause. Then they're willing to come do it for free. Right. But I think part of what drives, like, I'm a nurse. I feel like part of what drives some people away is seeing disparities in healthcare, like people finding out that they have these conditions and needing the medications or other things to prevent them from being hospitalized, but they keep coming in the hospital over and over again because, like you said, they can't afford those basic things that can allow them to continue to work, that can allow them to stay out of the hospital, like insulin. It's prohibitively expensive.
Right.
And so I definitely can relate as a nurse to wanting to volunteer my time to make it less sad when I go into work, knowing there's hope for these people to not have to be part of that revolving door.
Well, one of the things when people want to volunteer with us, I talk with them about make sure that you're being called to do service work, because this is not a job.
Right.
It's funny, you listen to our volunteers, if they get a call while they're volunteering, they're like, you have to call me later, I'm at work. They think this is their job. And so I think you have to have a heart to serve, number one, and you buy into the mission. You realize why the mission or the ministry is making a difference, and you want to be a part of being that difference.
And you say the mission or the ministry, would you say that this is a, like, religious organization?
No, we're not religious, but we are faith-based. So,
because you have, like, basically sponsors that are faith-based,
but our mission statement is very much faith-based as well, too. So, and most of our volunteers and staff all come from local churches as well.
That's wonderful.
And you know what else that I learned was surprising to me, because I thought, well, these people that come to us, they don't go to church. Not correct. They're just a different economic, socio status than we are.
You might go to church with them, right?
Sometimes you do.
Yeah, and you would never know, right?
That's
Which,
correct.
it's sad. It was like you would hope that people would be willing to ask for help at church, right? But sometimes that's not the case, right?
Well, and I do think that churches aren't equipped. You know, I know the church I go to refers people to us who need care. And the smaller churches we work with do too. Good. It's a matter of, does that church know about us? Which is part of what we're still doing, is even after 12 years, is getting out in the community and making sure, do you know about us? How can we help your church members or the people who work for you or people you go to school with? Your next door neighbors. I mean, sometimes people would be surprised who has to come to our clinic.
Yeah.
And obviously we don't reveal that, but I can tell you there's been some people you would, well, I know where they live. Why do they need to come to your clinic? Well, because maybe they've lost their job, maybe their husband's disabled and they don't have insurance anymore, or they're raising grandchildren and they can't afford to go. The circumstances in this situations are different. It doesn't matter. If somebody needs medical care, they need medical care. And we can sort out the other piece of it if they don't belong with us down the road. But we don't have people who take advantage of us. They're appreciative for what we do and what service we provide to them.
Yeah, and there's such a huge need. I mean, and lives are just really complicated. So I'm so thankful that this is an available place that people can look to get primary care, to get referrals, like you said, to specialty care. Because I know where I work, you don't need a referral for specialty care, like for us to make the appointment. But a lot of insurance providers do, even if they have insurance, they require that referral in order to cover the service. And a lot of people just need to know where to go. Right.
And one of the other reasons that people want to volunteer with us is because if you're working in a regular physician's office that does billing, it's hard. Your visits are hard. You've got constraints on you to make sure that all the T's are crossed and the I's are dotted. We don't do that because we don't bill anything. So it's back to basic patient care. Our visits are 30 minutes long. You don't hear of that anymore anywhere.
Right.
And so we take the time to get to know the patients. We take the time to know what's going on in their life that may be affecting their health. It's not a disease for them. Maybe a kid has gone off the tracks and there's a lot of stress and anger in the home. And how do we deal with that with them? Who do we get them to help them there as well?
Yeah, that holistic care of seeing everybody as a whole person.
Exactly.
Yeah, that's so important. On my other podcast, I just recorded an episode with our integrative medicine doctor, and we were talking about the importance of that holistic care and seeing people as a whole person, because you can take a pill for some things, but some things you just have to make life changes, and it's all about knowing where you can go to get some help, because it takes a village, right?
It does take a village, for sure.
So if people want to find you, you're at hopehealthclinicky.com.
Correct.
Okay. And then on Facebook?
It's Hope Health Clinic.
Okay.
And then our phone number is 502-225-6711.
All right. And they can call there to make an appointment?
They certainly can.
And what if they are just feeling it and they want to donate or volunteer? Do they need to go to the website for that?
They can go to the website, or they can call the clinic and ask for me. And I'd love to meet with new donors. I really do. That's, to me, very encouraging. I want to find out what has prompted them to serve or how to donate to the clinic, and just build that relationship.
Well, it sounds like you are on the brink of getting some more word out, right? So,
we are.
Are you looking for like invitations to events and things like that to get the word out?
If an organization would like for us to come and talk to them for 5, 10, 15 minutes and Q&A session, I would love that.
Yeah. Are there other organizations that you would like to know more about so that you guys can refer your patients to them?
We definitely would like to get more specialty providers in this area. If we don't have one where we're in the close proximity of where we're located, then we have to send our patients to the University of Kentucky, which that's a long drive.
And most of them are really coming from the other direction.
Right.
Yeah. Wow.
If they live in Louisville, we can send them to the University of Louisville. If they don't, then specialty care is sometimes can be very hard. And if they don't have a car that can make it, then often they're not able to get to those appointments.
Yeah. Do you guys help them with transportation applications?
We can give them gas cards.
Okay.
But we can't physically transport them.
Or like help with TARC 3 applications.
What type?
TARC 3 applications or anything like
there's
that?
There's
not a bus line out to there.
No,
right?
There's not. Once you leave Jefferson County, there's not a bus. Yeah, and there's definitely not a bus between Oldham County and Fayette County.
So it's really like they got to find a friend to give them a ride, and
Exactly.
you give them help with the gas money.
It would be great if we could find more specialty providers in this region that would see patients. When we come across one that's willing, we usually ask them to take 1 to 3 patients a month, which is not much. And normally, if they're part of a hospital system, there's a financial assistance package that we can work with the hospital organization to get them qualified, so that it's not like they're writing off everything.
Yeah, and a lot of people don't know that they can apply for programs like that.
Right.
So,
but that normally takes somebody to navigate that for them as well.
Exactly. Yeah, filling out just the form can be
Right.
prohibitive for
Right.
people.
Exactly.
So they're lucky to have you. Well, thank you so much, Janet, for
thank
sharing
you.
with us about Hope Health Clinic Kentucky. Look her up online if you would like to connect with them. And if not, just, keep it in mind. And if you hear somebody complaining, I can't go to the doctor because I don't have insurance, keep it in mind that Hope Health Clinic Kentucky exists, and that's what it's there for. For the next episode, subscribe to the Lou Review podcast, or follow me on @LouFoodReviews on Instagram to be notified the next time we have a new episode, where we interview local business owners and nonprofit leaders on what they're doing to make Louisville a great place. And I'll see you in the next episode.